When it comes to economic fallout from the pandemic, there's no blanket immunity for nonprofits. They account for 18% of the jobs in Massachusetts, but the pandemic has saddled them with huge financial losses and, in some cases, new costs and new demands for service. To bring us up to date on the problems and some possible remedies is the CEO of the Massachusetts Nonprofit Network, Jim Klocke. Thank you very much for being with us, Jim.
Thank you for having me, Chris.
Jim, I'm one of many people who might intuitively think of nonprofits as a small subset feeding off the main market economy, but I guess that's not correct. So what should we be thinking of here?
Well, first of all, it's a huge sector. We've done the studies before, but nonprofits employ over 550,000 people in Massachusetts. That's more jobs than manufacturing and financial services combined. So it's a big sector, hugely important, obviously, for all kinds of social needs, social issues. It's the sector that delivers education and healthcare and social services and so much more. So when the sector gets hit by the pandemic, it has very big ripple effects.
When you say ripple effects, what does that mean? Because when people, let's say, get laid off by these nonprofits, that means money that's not being spent elsewhere, right?
That's right. We did a few surveys recently of the sector, and our new Commonwealth Insights report shares the highlights. And just to give you a few of the most salient numbers, thus far, nonprofits in Massachusetts have lost over $8.6 billion in revenue. That number is going to get higher than $8.6 billion. When we ask nonprofits, 52% of them tell us that already they have either laid employees off or reduced employees' work hours. And when we say to people, how much of a lifeline do you have? How much cash on hand do you have? The average response is 11 months. And I will tell you, having looked at the survey responses, there's a wide variation. There are a lot of nonprofits who said to us, I only have 2 or 3 months of cash left on hand. So for many organizations, this is a existential challenge as well as a financial challenge and a service delivery challenge.
I want to ask you about the existential part as it might apply to arts and cultural organizations. Everybody knows they've been pretty much shut down as far as any kind of in-person performances. But when you say existential, does that mean even after the pandemic ends, there could be some permanent damage?
I think there is likely to be in various parts of the nonprofit sector. It varies from one organization to the next. Those organizations that have a very big fundraising base, they can last longer. Those organizations that receive government funding, some of them have received extra government funding recently, which is great. Others have not, and they're very nervous about what might or might not come in the next 6 months on the government funding side. The other challenge with this is that the timing of the virus hitting the spring of this year coincided with the biggest fundraising season for so many nonprofits. We all know events happen, dinners happen, serve-a-thons happen. Many of those had to be either canceled or postponed or converted into online events. And that too is having a real dollars impact.
You would think during a pandemic that health and service and human services rather would be too essential to fail, but what has been happening in that part of the nonprofit sector?
Well, first, there was a great rallying of support for hospitals and for health care providers, as well as for human service providers. There was extra government funding, federal government, state government early on. Massachusetts state government has done a good job getting extra money to human service providers so far. But as we all know, there was such a shift in the healthcare world. Everything was devoted to pandemic treatment. A lot of other treatments, elective surgeries, checkups, therapies had to be put on hold, and then people were reluctant to come back into hospitals when they opened up again. The message is that the hospitals are safe. People should go in for their treatment. It's a classic case of treat it now so you avoid a bigger problem later, but this is wreaking havoc with the operating plans and in some cases the financial underpinnings of healthcare organizations around the state.
And speaking of healthcare organizations, what about community health centers?
Very, very similar situation. They are on the front lines, so they have been essential to delivering services to people, getting people tested, getting people treated, and many of them are in neighborhoods that have been especially hard hit by the coronavirus, by virtue of many people in those neighborhoods had to go to their jobs no matter what. Historic healthcare problems, historic inequities in those neighborhoods have resulted in the pandemic hitting exceptionally hard, and so community health centers have been right at the forefront of that response. They have also grappled with this question. if people stop coming in for regular checkups, if people stop coming in for their treatments, which had been scheduled a year ago, it's going to cause those people more problems down the road. So we want to be sure people know they can go in for regular care. They should go in for regular treatments. The system has done a very good job both of treating COVID patients and also keeping COVID patients separate from all the other patients that come into an organization.
Well, certainly since the last time we discussed the state of things during the pandemic, I guess the financial damage has gotten bigger. But as far as remedies, what is needed that isn't available right now?
There are three things that we highlight in this report. The first is simply funding. It is needed. The funding that has been provided by government so far has been great, and more is needed. The second, there are a number of nonprofits who actually were hit with a very big new cost in this pandemic related to their unemployment insurance and unemployment benefits. Nonprofits can do something called self-insuring. It's a free choice they make. No one anticipated a pandemic. It turns out that during a pandemic, it spikes your costs up. So the federal government has provided some great relief. We're looking to see that relief expanded. And then the third area relates to charitable contributions. We've talked before about how important charitable contributions are to nonprofits. The Federal CARES Act temporarily made the federal charitable contribution tax deduction available to everybody this year, independent of their income level, which we think is a great thing. We think that should be expanded and made permanent. Here in Massachusetts, we now have restored the state charitable contributions tax deduction, a very good thing, available to everybody in Massachusetts, independent of their income level. Terrific benefit to hundreds of thousands of low and middle income residents in Massachusetts. And so that's a great thing. We're looking, frankly, for the federal government to catch up with Massachusetts in that regard.
Because what you're also doing this year is, it seems like there is still some business as usual happening. You have some excellence awards, and one of them is going to the Dudley Street Neighborhood Initiative. Roxbury. They were set up originally, I think, something like 35 years ago. You're recognizing them for innovation. What are they doing there?
Well, it's A, we're delighted to do these awards. B, they're a very deserving recipient. And one of the things that our judging panel really liked, which the winner, the Dudley Street winner, talked about in our online event on Wednesday, was the way they approached designing new programs and new services, going to and working with, not just taking input from the young people they were serving, but bringing young people in the community into the process of designing a new program. By all accounts, a win-win. Obviously, great for the young people to have the opportunity. And as the leaders of DSNI indicated, it resulted in a much better product, a much better service. DSNI was one of 6 honorees. We always have a challenge every year. We get a lot of nominations, and then the many deserving people. The question is, how do you pick just 6? But we did that. And frankly, this is a good time to remind everybody about the work that is being done all over the state in all types of nonprofits. It's creative, it's essential, and it's one of the things that makes Boston and Massachusetts unique.
One of the other groups being on, I think, is the Business Alliance for Education. What stands out in what they're doing?
Well, they were critical players in the passage of state legislation very recently on education. This was a big education bill. It's hard to get those passed at the State House. They don't come very often. This bill has a lot of good things in it, including significant new funding for schools serving students historically who have suffered from achievement gaps. We want to be sure that every single student in Massachusetts has the opportunity to get a great education. And while that opportunity is available to some, it's not available to all. So that was a big focus of the bill. MBAE and others worked with state legislators, with leaders in the business community and education community to try to come up with the right combination of funding and policies and reforms. And at the end of the day, they hit the mark. It produced a bill, and that bill is now law.
I'm sure you've spent a lot of time listening to people in nonprofits talking about their problems and even some of their new ideas. Do you see anything that's going to come down the line after the pandemic? They're going to have to do things differently in some way?
The answer to that question is definitely yes. First of all, we are going through an upheaval, and it is an upheaval in every way. It affects workplaces, it affects people in their homes, it affects financial operations of organizations. So everybody's going to come out of this in a different place than they were before. We hope better for everybody. The other thing is that the whole transition to the online world, both for, we mentioned before, fundraising events have gone online. Our awards event went online. The delivery of services is going online to a greater and greater degree. Telemedicine is a good example of that, but it's not the only one. If you think about after-school programs, if you think about educational services, now organizations have the ability to deliver those services virtually to students and people in their homes. That's a good thing. That's going to continue. It does, however, raise the stakes for completely building out high-speed broadband access to every household in Massachusetts. This was illustrated very starkly when schools went online in the spring. Laptops were provided, but not every household had that connectivity that you need. And even if we achieve that coronavirus vaccine that everybody's hoping for in the near to medium term, I don't doubt that a lot of this migration of things online is going to continue. So that's a good thing. That's an opportunity. And I think when we look back on this 5 or 10 years, we're going to say that was a change that accelerated during the pandemic and that really did stick after the pandemic.